Lisa, can you hear me?
I can.
Okay, good. I reclaimed host and unmuted you and myself. So we do have, it's 10:30, so I know we do have, everyone has time constraints. And I really want to start off by saying thank you to the department. Again, my name's Garth Reynolds. I'm the Executive Director of the Illinois Pharmacists Association. And thank you everyone who has joined us. And thank you to everyone who will be viewing this recording after we get the video posted. But we do want to thank the department and to Lisa Barnes and her staff for pulling this information together and co-hosting this informational webinar to help provide some more understanding to the Critical Access Pharmacy program. And I will mute myself and turn it over to Lisa.
Thanks, Garth. I think we'll just go ahead and jump right in. I want to make sure that you're able to see my screen, the PowerPoint.
Yes, we are.
Okay, perfect. Thank you. All right, so we're going to walk through some of the requirements for setting up Medi and for being able to attest in Medi. So we'll just kind of first go over the Critical Access Pharmacy Policy, Public Act 100-0587, and the administrative rules that accompany that Public Act require us to make quarterly payments to Critical Access Pharmacies. The Critical Access Pharmacies are defined in statute, and then we're further defined in the administrative rules, and the requirements are listed here. So in order to receive the critical access payments, Critical Access Pharmacies must attest to being eligible and meeting the requirements that are in statute and rule.
Hey, Lisa.
Yeah.
Sorry to interrupt. I think we're sharing your PowerPoint view, not your presentation view of the slides. If you go down to the share button, you'll be able to switch over to the presentation point because it didn't switch over to your next slide.
Oh, okay. Sorry, I'm a little challenged here. So are you seeing my first slide?
Yeah, we're still seeing the first slide and we're seeing it from the PowerPoint view, like you're editing it.
All right. Oh, I see why. Sorry, I had stopped my share. Are you able to see my screen now? And
yeah, I see that you're on slide 3. Yes.
Okay, perfect.
Okay, cool. Thank you.
All right. So the Critical Access Pharmacy attestation is required because HFS doesn't capture all of the information that would be necessary to identify critical access pharmacies within our provider enrollment system. So such as like the brick and mortar requirements and the ownership requirements. So that attestation then takes place in the department's Medi system. And it takes place in the department's Medi system because the pharmacies are attesting to their eligibility to receive funds through this program. And through the Medi system, we're able to ensure that the person attesting for the pharmacy is actually connected to that pharmacy, so that there isn't, so that we can ensure that someone who is not connected to the pharmacy does not make an attestation. Okay, so there are 2 types of registrations within Medi. There's an administrator and an employee. So the administrator just has more rights to manage access in the Medi system. There are step-by-step instructions available in the registration toolbox. The link is here on the PowerPoint, and I did send it out to Garth just before the meeting. But if you have issues registering for Medi, you can go to that link, and you should be able to resolve any issues that you might be having. Within Medi, you'll have to identify the quarter you're attesting to. You'll have to put in your pharmacy provider ID and the pharmacy name, and then you verify that the pharmacy meets the below criteria. So the criteria that you'll have to check are pharmacy owners have ownership or control interest in fewer than 10 pharmacies. The pharmacy is located within the boundaries of Illinois and is brick and mortar, meaning that the pharmacy location is open to the public and recipients visit the pharmacy to fill prescriptions. Pharmacy's mail order business represents no more than 50% of the prescriptions filled by the pharmacy, and that the pharmacy is located either in a county with less than 50,000 residents or in a HRSA designated medically underserved area. So within the attestation, you will be attesting to the quarter that the quarter that you're attesting to in terms of the fact that you met the eligibility during that entire quarter. And this kind of just goes back through what we're asking you to attest to and identify within that Medi site. If there are multiple stores, you can go to the Manage My Medi Account page to find out who the authorized users are and who the authorized businesses are. It allows the users to view the businesses they are associated with. Registrations are sorted by date of registration. You can make changes to previously entered registration information from this page. And it allows users to access authorization functions from this page. There are system requirements for Medi. There's a Java version requirement. If you're able to log into Medi, don't change your Java updates. If you need instructions on finding the Java version on your computer, there's a link here within this PowerPoint presentation that you can go to identify the version. And obviously, if you're unable to log in, you should verify the Java version that you have on your computer. There are also Windows and browsers requirements. Windows 10 will work with Medi, but Windows Edge does not work with Medi. So if you're using Windows 10, you'll have to use Internet Explorer 11. Windows Edge, Google Chrome, Safari, and Firefox are not supported with Medi. I did receive another question from Garth prior to the call about when funds would be distributed. So because of the fact that the payment amount is dependent upon the number of scripts that are eligible for critical access payment, and the number of scripts are dependent on the total universe of pharmacies who are eligible, we cannot calculate the payment and make the payments until we close the attestation period. Right now, it's my understanding there have been issues with providers being able to access Medi and just getting through that Medi registration process. And so until we're comfortable that the providers who intend to attest have been able to attest, we're not going to close the attestation site. Once it's closed, then we'll start the process of calculating the payments and making those payments. And we do have the encounter data in-house at this point to be able to make payments for the quarters that providers are attesting to today. So it's just really a matter of once that attestation period closes, we'll be able to start the process. So Garth, that's all I have. If there's questions, I'd be happy to answer them.
Okay, if anyone has any questions, if either you can hit your the raise your hand icon and I will unmute you. Oh, John's got one here. Hang on one second, John. John, you are unmuted. You can go ahead with your question.
Yeah, hi, Garth. Thanks for the time. When do you guys think the adaptation period will close? I know it's based on, providers enrolling, but do you have a timeline for that? And then how do we get these PowerPoint slides to help us walk through Medi? Because I've struggled with it.
So I think the registration, I don't have a time frame for closing the registration, but I think that once we're comfortable that providers have been able, the providers who are eligible have been able to work through the attestation process and any issues they had with Medi, we'll close it. We can set a deadline, but if we set a deadline, and I'm happy to do that, and it's probably the right thing to do, so that we all know what the deadline is that we're working with. But if we set a deadline, it is the deadline, and we'll start calculating payments after that. And if a pharmacy has not been able to attest, they just will not get payments for the quarters they're attesting to. So I guess I would really be looking for some feedback from providers on whether a significant number of providers are still unable to attest, or whether you've kind of worked through the Medi issues, excuse me. And if we set a deadline of 2 weeks out from today, would providers be able to complete the attestation process? Is that reasonable? I think those are questions.
And John, also to help answer your question on the slides, we'll be getting that posted on the IPHA website. Plus, we'll be sending it out via email notice to everybody. And also this video session will be converted and uploaded, so you can review it, and we can share it around to others so they can share the information as well. We did have a question in the chat about how many pharmacies qualify and how many have attested so far. And Lisa, I didn't know if you wanted to address that.
Sure. Give me 1 second here. We don't know how many qualify. Okay. So that's why we have to have an attestation. We aren't necessarily able to identify those providers. Give me a moment and I can tell you, apologize, I didn't have this handy, but I can tell you how many have attested, at least as of Monday of this week. We had 83 pharmacies as of Monday of this week.
Okay, thank you. And let me get my screen back under control here. Hang on 1 second. And then we had one other question in the chat. How far back does the attestation period cover? 2018, 2017. I know you did cover that, but if you would review it again, please, Lisa.
Sure, no problem. So the first quarter that pharmacies would be attesting to is April through June of 2018. That's the quarter on which the first payment for fiscal year 19 is based upon.
Mm-hmm. Okay. Thank you. And then we had one other question. Is there a phone number to call for further assistance if they have issues after reviewing the information here? There
is. If it's a Medi issue, we can give you that phone number, and I'll send this out to you, Garth. And then if it's a question for pharmacy policy staff, they would call Heather, it would be the
5565, and I want to follow the prompts to billing consultant and then pharmacy.
Okay, and if at least if you don't mind including that in the email, that'd be great too. We'll make sure
I will do that.
in the notice.
Yes. And then, Garth, I should have mentioned too that going forward, our plan is to have providers, so we'll open the attestation period for a given quarter the day after the quarter ends, and then the attestation period will be open for 30 days.
Okay.
We'll close at the end of that 30 days.
So after that quarter, so let's take an example of second quarter this year. So that's April to June. So attestation will be from July 1 to July 31st. Is that so? Am I understanding you correctly?
Yeah.
Okay. And then had a question: are the payments to help with reduced drug payment or dispensing fee loss by the MCOs? And I'll take that question. Yes, it was. This was an initiative that was put forward through negotiations by the budgeteers from both chambers in trying to find a way in the budget to provide some relief through the state budget. And this was the mechanism that was developed, and that's why it's taken a little bit of time to get all the pieces together, because it's a brand new approach that we haven't had before. So we appreciate everyone's patience as we've pulled everything together. Any other questions? Anyone else want to raise their hand or put a question into the chat? Very good questions, everyone. Oh, here we go. D. Rogan, you can go right ahead.
Okay. The total amount of money that's going to be dispersed changes with each quarter, or is that the max you're looking at for the entire program?
The maximum for each quarter is 2.5 million. It's 10 million per fiscal year.
Okay. Okay, that answered it.
Okay, thank you. And then we had another question in the chat. Is the gold dispensing fee amount $550, and will we be paid up to that amount?
So the applicable dispensing fee that will be used in the calculation is the department's dispensing fee of $240 and $550, depending on brand or generic.
Okay. Great questions, everyone. Anyone else have a question in the chat, or hit the raise your hand icon? Last call for questions. All right. Well, again, I want to thank Lisa Barnes and Heather Freeman and everyone at HFS who've pulled a lot together to pull this program into works and to be able to pull the information together with us on this webinar today. And I thank everyone for joining us this morning and asking some very good questions. And I'm sure that some of the participants who view this later on will have. And if there's no further questions, we'll let everyone get back to their morning. And thank you, everyone, for taking time today.
Thank you.
Thank you. Have a good day.
You too. Bye-bye.